And so this is the grand schema, the biological underpinning, if you like, for engineering immune defenses. The major hypothesis is that T cells can be genetically enhanced, that is to say, to acquire supraphysiological, non-natural properties to overcome the defense mechanisms that tumors utilize to fend off immune responses. And in doing so, there are two main objectives. One is to make the T cell recognize the cancer. So that's an issue of specificity, and for that you need to identify an appropriate target, a molecule that's on the surface of the cancer. The second thing that you can do when engineering T cells is to increase their functions so that they will acquire properties that are more than the usual, if you like, and will enable to reject tumors. CD19 is the molecule that's on the surface of the majority of leukemias and lymphomas. And as important as where this molecule is found is where it is not found. And remember, the problem is specificity, of singling out the tumor without doing harm to normal tissues. Well, this molecule is expressed on some normal cells. They're all the B cells that we have in the body. But very importantly, it's nowhere else in the body. So if you were able to make a T cell that eliminated, that eradicated any cell in the body that possesses this CD19 molecule, you would predictably destroy all the normal B cells, which is not ideal, but can be handled in the hospital, but nothing else. And that's much better than what conventional chemotherapies can do. So what we see is that there is not just what's called a complete remission, but what hematologists call a molecular remission. That's the best response that you can hope to get in patients like this. So in our studies, we then give the standard of care to these patients, which normally would be a bone marrow transplantation. At the stage of their disease, these patients were not even eligible for that. You wouldn't even propose that because it's guaranteed to fail. However, it is known to treat patients, so we follow this treatment. We're now moving our CLL therapy to an earlier stage of disease. We're also giving this therapy in pediatric patients using a different kind of T cell from a donor. This is not the patient's own T cells. We're also starting a study now in lymphoma, another disease that expresses CD19, and recently treated 2 patients who also have complete remissions, actually, and are now starting a different study in ALL in children, quite similar to what Carl is doing at the University of Pennsylvania.